Terrace again with another video. This time it's about hallucinogen persisting perception disorder, HPPD, and its relationship to depersonalization disorder. Now, over the years, I've gotten a lot of people asking about this because a lot of people with HPPD also have depersonalization disorder. And a lot of times that means the chronic disorder. They have HPPD symptoms, and they also feel cut off from reality. They feel cut off from themselves. Okay, so I'm going to be talking about how, I'll describe the symptoms of these two and talk about how they relate and how oftentimes, if someone's taking LSD or is taking shrooms or whatever hallucinogen causes the HPPD symptoms, they'll also feel unreal. But not everybody with HPPD also gets depersonalization disorder. Not everyone. So to start off, I'll just read from the DSM-5, the Diagnostic and Statistical Manual, 5th edition, about the symptoms of HPPD. Hallucinogen persisting perception disorder. That's a long name. Diagnostic criteria. A. Following cessation of use of a hallucinogen, the re-experiencing of one or more of the perceptual symptoms that were experienced while intoxicated with the hallucinogen. For example, geometric hallucinations, false perceptions of movement in the peripheral visual fields, flashes of color, intensified color, trails of images of moving objects, positive afterimages, halos around objects, macropsia and micropsia. So macropsia is where things look bigger than they actually are. Micropsia is where they look smaller than they actually are. Okay, and it also says in here that it causes distress and that the symptoms aren't attributable to another condition. So people oftentimes get flashbacks of the high they had while on LSD or shrooms, and they have more visual disturbances going on. They'll see things moving that aren't moving. That doesn't really happen in depersonalization disorder. Okay. The thing is, let's say you take LSD, shrooms, and you have a really bad trip, and you have a panic attack. Or you just feel really strange, okay? And you sober up, all right? It's been a few days, it's been a week, it's been a month, and you don't feel real. The world around you doesn't feel real. If you feel like you're in a movie, that's derealization, okay? Things might feel flat. Micropsia and macropsia are actually symptoms of depersonalization disorder that overlap. Okay, if you feel that, if you feel cut off from yourself, like if you look in the mirror and you don't feel like you're the one moving your hands, or you just look at yourself and you go like, I don't really feel like I'm me, that's depersonalization. Okay, if you feel like you've lost your soul and you're experiencing a lot of anxiety, especially, and you think you've gone insane, and you've got depersonalization disorder, and especially if it doesn't go away for a couple months, yeah, it sounds like you've got depersonalization disorder. Now, I got depersonalization disorder through smoking weed. It's very common. A lot of people get DP from hallucinogenic drugs. It's very common. So it's important to treat the depersonalization if you have it, and that's my whole thing. I mean, I've got, if you're seeing me for the first time, you have HPPD, go through a lot of my videos, my website, I've got all these articles on there. I also have a 10-hour program that really goes into every single element of depersonalization, because here's the thing, you might be thinking, well, okay, I got HPPD, and let's say you have depersonalization too. You got this from the drug. But for depersonalization, the drug is really just the trigger. I mean, have you ever wondered why so many other people that do these drugs don't get these symptoms? A lot of it has to do with your childhood circumstances. And this might sound a little strange, but there's certain things that happen in the childhood of people that get depersonalization that lays the groundwork for dissociating later in life. Because what you're experiencing is dissociative symptoms. If you feel cut off from the world and cut off from yourself, depersonalization, derealization, either one or both all the time, that's the chronic That's the chronic condition of depersonalization disorder, DPD. And this is not just caused by the drug you took. It sounds weird. And when I smoked weed and I had a panic attack, and I got stuck in depersonalization for a couple of years, and I had to battle and fight my way out of it, and I studied the hell out of the damn disorder, you know. But it's not just caused by the drug you took, which seems a little weird because that's just the tip of the iceberg. You know, most of the iceberg is underwater, and the same thing psychologically with depersonalization disorder. The trigger is just the little tip that you experience. Now, it's a traumatic experience. Getting high, especially if you've got a panic attack, you just feel crazy, especially if you've got HPPD along with your depersonalization. I mean, you might feel like you're losing your mind, like the world isn't real, you've lost your soul, and all these things. But it's not just caused by the drug. Okay, there's all these childhood circumstances, stuff like disorganized attachment, dysfunctional families. It's really a complex post-traumatic stress disorder. And this is really trauma from the past that you probably healed from, and you know, you kind of went along with your life, and then you took this drug, and you probably also have a sensitive temperament. There's something called a highly sensitive person. And, you know, there's a book by Elaine Aron called The Highly Sensitive Person, talks about the personality type, which is related to what other psychologists call the inhibited personality type. And people like this, who have had adverse to just not adequate childhoods, they come upon these hallucinogenic drugs, are set for a recipe for dissociation, for depersonalization. So, yeah, I mean, you know, you've got to treat depersonalization. And I recommend, obviously, like I have a 10-hour program on it that you could try out, and it's really the best thing out there for people with depersonalization. I mean, you should really treat both. Right now, if you're having a panic attack related to LSD or shrooms or whatever hallucinogen you took, just take it easy on yourself. You know, go easy on yourself right now. Try to learn to relax, which I know that's like, if you're having a panic attack right now, you have to let the panic attack kind of do its thing and ride the wave. But go easy on yourself for a while, okay? Practice some relaxation, you know, and check out my videos. But yeah, you need to treat the depersonalization. You really do. So many people with HPPD have depersonalization disorder, and I got out of it. Granted, I never experienced HPPD in particular, but I know what I have to offer can really help for the depersonalization end of it, which is really, goddamn, it's really nice to get over that shit. Let's just say. And you should abstain. Just stop using the drugs that caused or that triggered your depersonalization or that caused your HPPD. I mean, that you might think that's obvious, but some people, you know, especially if they have a social group that uses the drug and there's this social pressure to use it, I don't know, get some new friends. Or just, you know, set a boundary for yourself. Say, look, I can't do this stuff. You know, you're not like everybody else. This idea in our culture that, oh, like, you know, these drugs don't affect everyone the same. You know, I'm never smoking weed again. Never. And LSD? Oh my God. I never gonna touch that shit. Never. So it's a decision you have to make in terms of abstaining. But yeah, abstain from that stuff. Even stuff like caffeine, really, it's not good for you. Alcohol can make you feel relaxed for a little bit, you know? Like some psychiatrists will prescribe benzodiazepines for HPPD, and they also do that for people with depersonalization, which they do help you relax, but they can become addictive because they're similar to alcohol in terms of relaxing you, and then they become addictive. But you got to go easy on yourself. Try to, for the first few days, if you're having a panic attack right now, distract yourself and try to relax. But eventually, if the depersonalization doesn't go away, you got to deal with it. It might be due to a lot of childhood issues. Sounds weird, but it's true. So yeah, that's really all I have to say. The two disorders are really interrelated. Sometimes people have HPPD and they don't have depersonalization, but a lot of people also have depersonalization disorder. Okay, and you know, it could be really a path of self-discovery if you really go down the path into crushing depersonalization like I did. But depersonalization is something you got to treat. So that's the video for today. Hopefully that was helpful. I've gotten a lot of questions over the years about this. So take care.